If you are struggling with a drug or alcohol addiction, it is important to know the pros and cons of every level of care so that you can make the best decision for your needs. If you're getting a lot of advice from different people, it can be really confusing to choose the best route to take. It's not good to become overwhelmed with conflicting information and advice because that could deter you from continuing to seek out the help that you need. Through this entire process, you have to remember that what works for someone else may not work for you. We're going to start off on the positive side of things and discuss the pros first. Outpatient treatment is much less disruptive to a person's life compared to all other forms of treatment. If you have a family, you will be able to return to them at the end of the day. If you're in the middle of school, you will be able to take the necessary classes and then participate in outpatient treatment. If you're doing evening outpatient treatment, you can go to work during the first half of the day. Another pro of outpatient treatment is that counseling sessions are sometimes offered in the evenings and on the weekends. This is to ensure that treatment and recovery is attainable for all people from all backgrounds and lifestyles. Outpatient treatment is ideal for anyone who is unable to leave behind their families or careers and check into inpatient treatment. Another pro is that you can take what you are learning in outpatient treatment daily and put it into effect in real-life scenarios almost immediately. Maybe you learn some meditation techniques to deal with triggers. When you go home that same night and come face-to-face with that trigger, in that moment, you are immediately able to start using the meditation technique that you learned at outpatient treatment. Outpatient also allows you to include your family in the sessions and help your support network understand the challenges that you're going through on a day-to-day basis. In many cases, family will be the ones transporting their loved ones back and forth every day that they have scheduled outpatient groups. Your family members can talk to you on a daily basis about how you're doing. Your counselors and therapists can keep in touch with your family and update them as they pick you up. Outpatient tends to be more affordable. Although inpatient treatment is the best level of care that you can find, it tends to be pricey. Insurance companies are more likely to cover outpatient treatment versus inpatient treatment. If your insurance company refuses to cover inpatient treatment, then outpatient treatment may be the best option for you. Outpatient would also be the best option economically if you're paying for your treatment out of pocket. People who are trying to get help for their alcohol or drug addiction should not be deterred by finances. Outpatient gives people the option to get care at a lower price than inpatient treatment. The first and most obvious con about outpatient treatment is that it doesn't include medically supervised detox like an inpatient facility does. If you have a severe addiction to a substance that can be fatal during detox, then it's best for you to go to an inpatient where you can be supervised by the proper medical staff. You may still have to face difficult and stressful situations at home that led you to drink or use. Without enough time being sober, it could easily lead you into a relapse. The access that you have to your counselor will also be more limited than it would be if you were in an inpatient facility. Another important thing to consider is that patients that go into inpatient treatment develop strong bonds with the other people in treatment alongside them. In outpatient treatment, you may have a harder time developing supportive relationships with your peers in treatment. Outpatient, as good as it may be, isn't the highest level of treatment. If you really want to have the highest level of care and treatment, then you should consider inpatient. However, if you are unable to go inpatient, then outpatient is the best option. It's important to mention that if you have a severe addiction to alcohol or drugs that has gone on for many years, it is best that you go to inpatient treatment. The more severe the problem, the higher the care is needed. If you have any questions about outpatient treatment or otherwise, feel free to give us a call today and we can discuss your options. Please feel free to comment, like, or subscribe to our channel.